Hi everyone, my name is Rebecca Garcia Pinillos. I'm speaking to you as past president of the Association of Government Vets in the UK on the topic veterinary services well-being as a key element of resilient fast crisis. And I really would like to thank the organizers for inviting me to speak on this topic, which I think is really, really important. So firstly, I would like to make clear that during a crisis, everyone's well-being is important, including livestock. This talk focuses specifically on veterinary services, but this doesn't mean that the well-being of other groups are less important. And I just wanted to make sure that I clear that from the beginning. And as we see in this map, fast crises are affecting many different countries, and as a result, millions of people. And during a disease outbreak, the priority is to stop disease and to stop disease spreading. But we also need to ensure that we preserve human safety, that we preserve animal welfare, that we preserve economical interest, the sustainability of the sector. And for that, we need to involve a number of different elements, including food security, feed security, manpower, disease surveillance capabilities, vaccines, skills and training, epidemiology, testing, inspection, etc. For this, veterinary services play a key role during disease control crisis. And as such, their well-being or our well-being is paramount in order to ensure that we have an efficient and continued service response to the crisis. Some mental health responders have already made clear in the context of veterinary services that there is a feeling within the profession that colleagues understand us better, and this might well be the case with other professions. And the fact that someone is living and breathing the same things, the same high and lows, facilitates these connections. Also, some of us tend to keep things quiet. Therefore, it's paramount to create spaces to talk and also to help each other. And I would like to talk to you about the Wellbeing Survey that we did in the UK back in 2018 when I was president of the Association of Government Vets. And we were trying to find out what level of well-being government vets that have operated within the UK. We circulated the survey via a number of different means, mainly online, using intranets, using circulations within different government departments, social media links, and we received over 700 responses, most of which originated from vets that have been working for over 10 years, full time, and spending the majority of their working time on the field. What did we find? About a third of the respondents we had have been involved in mass culling events, and almost 2/3 of these found the work emotionally challenging. Only 17% of those reported that they had support mechanisms in place during the mass culling exercises, and only half of those made use of them. So it's not just enough to have a support mechanism, you also need to be able to use it and to have the willingness and the drive to do it and the time as well. And most of the respondents were working in organizations with a walk-away policy, which means we can move and leave the premises if we feel at risk, for example, but more than a quarter actually were unaware if their company had these policies. We asked vets what support tools were being used, and as you see, the majority mentioned indeed colleagues. 108 respondents mentioned they were referring to colleagues when they needed support. Some of them referred to their management, vet support groups, and different support groups such as VetLife, human resources, tools that might be available, mentor figures, intranet, internet, etc. So as you see, there is a mixture of things going from colleagues to friends, family coaching, and different resources, but the one prevalent at the top is colleagues. Many of the respondents said that they had difficulties and they had to engaging with difficult conversations, but only about a quarter have received training on this. In the report, we were looking at how we could address this gap. We are trained as vets, but are we training in those soft skills that we need to do our job as well, particularly during crisis? And also they mentioned support, getting support from colleagues and being part of a team as something key. We asked vets also whether any of us had witnessed situations that were found distressing. And as you can see, we have here euthanasia, we have welfare, we have foot and mouth, we have distressing, we have FMD. So foot and mouth disease really came as a prominent word within the cloud. And this was done in 2018. The main outbreak in the UK was 2001. So that means that 17 years after, this was very much present as a distressing scenario in the minds of many vets. And in fact, when you look at Google and you put foot and mouth disease or FMD, you come across images like that with many of them are going back to the calpires of 2001, although some are from other countries now. But it is important to understand that this can stay for us and in our minds for a very, very long time. So examples of well-being factors that are affecting vet, I've put a few here from my personal experience, from experiences speaking to other colleagues, and also from the survey that we undertook. So we have our basic needs. We all need to eat, we all need to drink, to go to the toilet, to have a break. And do we have time for breaks? Are we working long hours? How are we managing our basic needs? And for those that are working in full protective equipments, you might understand how challenging can be a simple task like going to the toilet, where you have to ungear, you have to follow cleaning and disinfection and biosecurity procedures. So it's not as simple as just quickly going away 5 minutes and coming back, but there is much more behind it. And again, taking the time for breaks, etc. Being on call when you are in a very extended crisis, the on-call duties might become increasingly burdensome. Many vets are doing this in addition to their business as usual roles. So actually, if the crisis increases and goes for a long time, this may become a stress factor within veterinary services that needs to be addressed and managed. And also how we are coping with our personal life, how we are managing between all these extended working hours, how being on call, how we are managing our personal lives with that, which is a key element for our well-being. Also the team or the lack of team or our sense of perspective. Do we see the light at the end of the tunnel? Is this going to be going on forever? Can we cope with loss? How are we coping with loss, or even coping with other people suffering for the loss they are having in their farms? Our equipment most times should be designed to help us and to facilitate our job. But if we end up with a protective equipment that doesn't fit us, or stunning equipment that doesn't work, that can actually become a stress factor again and impact our well-being and possibly the well-being of many others. The type of housing, the access we have to the animals we have to work with, the restraining facilities, the support that we have, all of these. How can we get to the farm? Is it easy to get there? Is it not? What weather do we have? Is it really cold? Is it really hot? Is it raining? So our masks are fogging if we're wearing protective equipment mask. Is it really hot? So actually it's becoming a nightmare to be in a protective suit. So what is the weather like? That is things that we live with, but actually can become increasingly and exponentially bigger impacts in a crisis. And the ethical dilemmas are something very present in the veterinary profession. And clearly in a fast outbreak, we have the biggest dilemma, to kill or not to kill, with many of our colleagues are being faced on many times during their careers. And it's not an easy decision to take. What are the expectations that we have as a veterinary profession or as a professional ourselves, and what are the external expectations that people have on veterinary services? Can those expectations be managed? Can they be fulfilled? Can we fulfill them? It might be that the expectations are not paired, so that's something important as well. And on top of the crisis, we could have additional elements that are going to impact everybody's well-being. So we may be in a country at war. We may be suffering from inclement weather with drought or with flooding. We may have a lack of resources because our country simply does not have the equipment for managing this crisis, or because the crisis has been going on for so long that we have run out of resources. We may have other disease incursions, and we can think now, for example, on the north of Europe, where many countries are dealing with highly pathogenic avian flu outbreaks, a bit different to FMD, but also with the COVID pandemic. So again, we have multiple disease incursions, and veterinary services are having to manage different areas and different aspects. I would like to conclude with 3 key concluding remarks. It's very important that we identify well-being as a key component of resilient veterinary services. It's very important that we explore well-being impact factors for veterinary services. And once we are aware what those impact factors are, it's really then important to identify the tools and processes that we can use to help manage and improve well-being within veterinary services during a crisis, to ensure that we can do so in a resilient way. Thank you very much, everybody. And I do hope that this talk helps you to reflect about the well-being of your veterinary services.